Hello everyone, this is Singh Abhilasha from group number 1932, second division. I'm a third year student from Institute Medical Academy named after S.I. George Whiskey, KFU named after v.zadnipryani. Today I'm here to present a short video on inguinal canal, its content, its wall, hernia and description about all of its type. First of all, I would like to thank my senior professor Igor v.zadnipryani and Sir Pavlov Kulbaba. Now let's begin. Inguinal canal. It is an oblique intermuscular passage through the lower part of the anterior abdominal wall. It is present in both sexes. It allows structures to pass to and from the testes to the abdomen in males. In females, it permits the passage of the round ligament to the uterus from the uterus to the labium majus. It extends from the deep inguinal ring downwards and medially to the superficial inguinal ring. It lies parallel to and immediately above the inguinal ligament. Deep inguinal ring. It is an oval opening in the fascia transversalis. It lies about 1.3 cm above the inguinal ligament, midway between the anterosuperior iliac spine and the symphysis pubis. The margins of the ring give attachment to the internal spermatic fascia. Superficial inguinal ring. It is triangular in shape, lies in the aponeurosis of the external oblique muscle, lies immediately above and middle to the pubic tubercle. Its margin give attachment to the external spermatic fascia. Now let's talk about the inguinal walls. First of all, we'll discuss about the anterior wall. It is formed along its entire length by aponeurosis of the external oblique muscle. It is reinforced in its lateral third by the origin of the internal oblique from inguinal ligament. This wall is the strongest where it lies opposite to the weakest part of the posterior wall, that is deep inguinal ring. Posterior wall. It is formed along its entire length by the fascia transversalis. It is reinforced in its medial third by conjoint tendon, the common tendon of insertion of internal oblique and transversus, attached to the pubic crest and pectineal line. Inferior wall. Inguinal ligament and its medial end, the lacunar ligament. Superior wall, that is also called as roof, is formed by the arcing lowest fibers of the internal oblique and transversus abdominis muscles. The contents of the inguinal canal in male is spermatic cord, ilioinguinal nerve, and genital branch of the genitofemoral nerve. In female, it contains round ligament of uterus, ilioinguinal nerve, genital branch of the genitofemoral nerve. The contents of the spermatic cord also contain three types of arteries: to vas deferens, testicular artery, cremasteric artery. Three facial nerves, that is external spermatic, cremasteric, internal spermatic fascia. Three types of nerves are also found, that is genital branch of the genitofemoral nerve, sympathetic and visceral efferent fibers, ilioinguinal nerve. Here you can clearly see the content of the inguinal canal in males. What is a hernia? When part of an internal organ or tissue bulges through a weak area of muscle, that is known as hernia. Mostly hernias are seen in abdomen. That is the reason we will discuss about the abdominal hernias. Hernia is an abnormal protrusion of the abdominal contents through a weakness or defect along the wall of the abdomen. It can be congenital or acquired. The classification on the anatomic basis is into three types. That is anterior hernia, groin hernia, and pelvic hernia. Based on the pathophysiology, hernia is divided into three parts. That is reducible hernia, incarceration, strangulations. Reducible hernia is contents of the hernia can freely return to the abdominal cavity. In incarceration, inability of the contents of the hernia to return to their original cavity. Strangulation is the contents of the hernia are incarcerated. Inguinal hernia is a protrusion of abdominal cavity contents through the inguinal canal. On the basis of anatomical classification, there are some types of hernia which we'll discuss quite in deep. The first one is indirect hernia. The abdominal contents herniation occurs through the deep ring into the inguinal canal, comes out through the superficial ring. It may extend into the scrotum. Depending upon extent, it may complete or incomplete. It is more common in young. Now talking about direct hernia. Contents herniate directly through the posterior wall of the inguinal canal through the Hessel-Beck's triangle. It is a weakness in posterior wall of the inguinal canal. It is bounded laterally by inferior epigastric artery, medially by lateral border of the rectus abdominis muscle, inferiorly by the inguinal ligament, and it is more common in old. Here you can clearly see the normal structure and the inguinal hernia into scrotum, inguinal hernia into canal. Epigastric and umbilical hernia. Umbilical or epigastric hernias occur when a part of the intestine pushes through an opening in the abdominal or stomach muscles. Umbilical hernias develop at the belly button, whereas epigastric hernias along the linea alba from the xiphoid process to the umbilicus. These type of hernias are more common in infants and will typically resolve on their own within the first 5 years. Incisional hernias, hernias that occur through the scar tissue of past surgical incisions due to poor wound healing and excessive tension. Spigelian hernias, hernias that occur through the transversus abdominis muscle aponeurosis is called spigellinous aponeurosis. Bound by lateral edge of the rectus muscle, medially and linea semilunaris laterally, most common in the spigelineal belt, the transverse 6 cm zone around the arcuate line. The majority of these hernias are small, that is 1 to 2 cm. It is most common during the 4 to 7 decades of life. Peristomal hernias. It potential complication after creation of a stoma. Peristomal hernia occur when the intestines press outsides near its stoma. Occurs with up to 50% of colostomies, less common with ileostomy. Lumbar hernia. Grinfeld's triangle. Herniation of abdominal contents to the back, 12th rib, internal oblique, and sacrospinalis muscle, covered by latissimus dorsi. Petit's triangle. Latissimus dorsi, external oblique, and iliac crest, covered by superficial fascia. Thank you so much for listening to me for a long time. Here we wrap up. Thank you.